Um, Hello, everybody. Good morning if you are outside our Arab world, and Assalamu alaikum and good evening for everybody who is or she is following us from the region. My name is Basil Mala'ab. I'm the healthcare advisor for the Compass Health Consultancy company. We are here on this webinar to welcome you and to take you throughout this 1-hour webinar to discuss very important element in our region that is pertaining to training for perioperative nurses. The title of our webinar for today is Train to Retain Perioperative Nurses and Upscale to Sustain Safe Surgical Practices. As it is known, patient safety is a daily challenge in the operating room, and perioperative nurses shortage is one of the main concerns of healthcare facilities around the world. The perioperative nurses are required to have a certain set of skills that are not typically taught in the nursing schools or outside the OR. So this webinar will spot the light on how to enhance the perioperative nurses' skills and knowledge, and our esteemed guest speakers will highlight on the challenges faced in the perioperative practice, the national and international strategies to overcome the shortage in perioperative nurses, the competencies that those nurses should have, and their role in patient safety, in addition to the importance of training and retraining perioperative nurses to upscale the surgical practices. And it will include the announcement to launch the first AURN course in the UAE and in the region for perioperative nurses, which is called Periop 101. Just as a few notes, for everybody attending this webinar, we'd like to thank you for your presence with us. And if you have any comment or you need any illustration, please, you find the chat box, insert your query there. And for any questions that to be posed to the panelists and the speakers joining us today, please use the Q&A section. And this webinar will be recorded, and after the session, you will be receiving the link that includes the recording. Without any further delay, I'll move the talk to our first speaker and panelist for today. Is Dr. or Ms. Linda available now?
I haven't heard back yet. I have Michelle working on that, Caroline.
Okay. Okay. We have Ms. Linda now with us. Hello, Ms. Linda.
Hello.
Welcome. We are going live now. I just started the introduction for this webinar, and I'm reaching now to the stage to open the floor for discussion with you, for your participation with us to talk about the AURN mission and portfolio and the partnership with the Compass company to deliver the AURN course in the Middle East and Africa region, and to highlight some of the perioperative nursing issues internationally. So I'd like to move the talk to you, Ms. Linda. Are you ready?
I'm having some difficulty with my camera right now.
We can see you properly in this. Now it's out. Ms. Linda?
Yeah, I've lost now. Just a minute. I'll have to go off and come back on.
Okay. Shall we wait 1 additional minute for Linda to come back? Let me introduce my colleague during this time. She will be moderating also or co-moderating this webinar. She's Ms. Dania Wahbe. Ms. Dania, she is the Director of Academy for Training and Excellence at the Compass Health Consultancy. And she will be moving us throughout the different talks and participations throughout this webinar.
Thank you, Basil.
You're welcome. We're still waiting for Linda. Anyways, I hope today's webinar will shed a light on very important aspect in our healthcare setup, which is the perioperative practice, and how and what we can do in order to improve overall the surgical practices in this regard. You know, the OR is a cornerstone in the hospital in general. It affects the revenues, it affects the patient safety in a very direct way. So whatever is done to enhance and improve the practices at that level, especially regarding nursing, perioperative nursing practice, is of big favor, and it has a direct result on revenues, on patient safety, and other aspects. Jamie, what do you think of Linda? She's still having the trouble in accessing.
She is. I was just informed that my IT team is reaching out to her to see if they can get her straightened out. Maybe, not sure if we should move on to the next introduction or wait for her. It's up to you.
Caroline, would you wish to take the lead and start? Okay, so let me introduce Ms. Caroline Bilen. She's the founder and the CEO of the Compass Health Consultancy, and she will address the activities that the Compass Health Consultancy does, the mission and the vision, and the other activities related to this, the launching of this course. So please, Ms. Caroline, would you like to unmute yourself and start your part, please?
Okay. Welcome, everyone. Thank you so much for taking the time today to join the Compass Health Consultancy webinar. We trust that you will enjoy the insights shared by our guest speakers. Healthcare organizations around the world are facing a challenge in dealing with higher patient loads and limited healthcare professional resources. The Compass Health Consultancy is pioneering in consulting, training, and coaching of healthcare professionals and organizations across the Middle East and Africa. Our team consists of passionate healthcare leaders, advisors, and clinical educators with extensive experience within their field of expertise. We at the Compass Health Consultancy understand the complex challenges that healthcare providers are facing daily across healthcare settings. Therefore, we execute tailor-made solutions with your team to ensure you never have to worry about missing your milestone. Staff performance has a huge impact on healthcare organization success. We offer comprehensive and practical training courses and workshops to build competency of the healthcare professionals and elevate the standard of care. Our courses are accredited internationally. As you know, operating room is considered the heart of the hospitals and the main pillar of hospital profitability. Patient safety in surgeries remain a daily challenge in OR. Hospitals are struggling to measure OR efficiency and performance. Surgical procedures present a huge risk to patients, and adverse patients' outcomes are usually due to insufficient skills among the surgical staff. Thus, These skills are required to be developed and maintained consistently. Unfortunately, COVID-19 had a big impact on OR nurses' shortage. This is due to retirement of the experienced nurses, there is no career development, and insufficient education programs. We have partnered with local and international organizations to elevate the standard of care in MEA region. We at the TheCompassHC Consultancy believe that safe surgery saves lives. Our nurses are required to have a specialized set of skills that are not typically taught in nursing school or outside the OR. Our partnership with AORN enable us to bring cutting-edge knowledge and practical skills required to your operating room settings. We have launched Periop 101 in UAE, which provide the perioperative nurses with or without experience in OR with the knowledge and clinically necessary skills to function as a perioperative nurse. The program will be launched as well in the Middle East and Africa, other country region. Our education programs are delivered in university, such Gulf Medical University, and endorsed by nursing association such as Emirates Nursing, Emirates Nursing Association. We at the TheCompassHC Consultancy want to partner with you to build a strong evidence clinical foundation in surgical care. We want to work with you to standardize perioperative nurses education program in MEA region, to improve operating room efficiency and safety, and to empower perioperative nurses and healthcare organizations to achieve safe surgery for every patient and every time. Finally, it's our mission to help you train to retain perioperative nurses and upscale to sustain safe surgical practices in your operating room. Thank you so much for your attention.
Thank you, Caroline. That's a nice overview about the Compass strategy. Now, I guess Linda has joined us. Miss Linda?
Yes, thank
able
you.
to-
I'm so sorry. I had some
Okay, great.
Wi-Fi issues, but thank you so
We'd
much.
like to give you a big welcome to this webinar and to take the time to all the effort to be with us and to help us to be able to bring this important course to the region. You're still with us?
I am. Do you hear me?
Okay. Yes, sure.
Okay.
Okay. So if you're ready, we'll give you the turn to start your part.
All right. Thank you so much.
Okay, great. Please,
Thank
over
you,
to you.
Caroline. Thank you, Caroline, for your wonderful comments and explanation about how important well-rounded education for perioperative nurses is. I am Linda Groh. I am the CEO of the Association of Perioperative Registered Nurses. And we are the #1 resource in the world that provides the only evidence-based resources that perioperative nurses use worldwide to rely on their specialty education and training. With Periop 101, the nurses will learn that it's necessary, what's necessary to care for the surgical patients, to be safe, effective, and support to the team, and contribute to the facilities as a provider of exceptional and safe patient care. This is the professional level of practice, one which all nurses should strive for when they join the ranks of perioperative nurses. Whether they are new to the OR or whether they are going to be refining and renewing their education and knowledge, Periop 101 will take hard work on their part to understand what perioperative nursing is all about. But it will be fun. We promise that. We have engaged curriculum that will really help the students complete the course curriculum and will really elevate their confidence in their knowledge and practice. Periop 101 is a core curriculum, and it is the premier nurse education program for RNs that are entering the perioperative specialty. It fully prepares nurses with consistent, current information in the classroom and online, and with clinical experience to enforce and reinforce what they've learned. The course has been developed using AORN guidelines for perioperative practice to provide RNs with an evidence-based, comprehensive clinical foundation to ensure the optimal patient outcomes for the surgical patient. Surgical facilities that use Periop 101 have reported that they have quality improvement. They reduce the training time for the staff, for the educators, and they have strong recruitment and retention of their students and their staff. We are delighted to be partnering with Compass Consultancy on this program, and I will be available to answer any questions that you may have. Thank you so much.
Ms. Linda, thank you so much for those nice words. Definitely this partnership with AORN is something of a great privilege to the Compass and generally for all institutions around the world. And this is a great pleasure for us. Thank you for this. Definitely for all the attendees, if you have any questions to be raised, please, I remind you to put it in the Q&A section. And if you have concerns or things to discuss about in the chat box. Now I'll move the turn to my colleague, Ms. Dania Wehbi, to proceed in introducing our esteemed guests and to address the different elements of the agenda of today. To you, Dania.
Thank you. Yes, thank you, Basil. Hello and welcome all of you again. Our next speaker is Mrs. Jamie Joachim. Mrs. Jamie is a Senior Account Executive Healthcare Organization for the AORN. Today, Jamie will give us an overview and course description of the Perioperative 101 program. Welcome, Jamie. The floor is yours.
Thank you so much, Dania. So I'm just going to start by just thanking you all. This has been such a great endeavor. Caroline, it's been excellent to work with you. I'm so excited to see the improvements that we're going to be making in your region. So Periop 101 is comprised of information taken directly from AORN's guidelines for perioperative practice, which, as many of you know, this is the worldwide gold standard for care of the patient in the perioperative world. It covers topics ranging from the perioperative interview to best practices in patient skin antisepsis and positioning. And it also addresses topics such as specimen handling, instrumentation, and sterilization process, just to name a few. It's truly a comprehensive program that covers what perioperative nurses need to know when practicing in this high-risk specialty. The learner will experience a blended learning program, complete with didactic training, skills labs for hands-on experience, and a clinical preceptorship. The goal of the Periop 101 program is to provide the must-have information as it relates to the guidelines, as well as the rationale behind this information in order to generate competent, confident perioperative nurses. So the main goal is safe patient care, along with keeping the safety of our healthcare team members in mind as well. We're all focused on quality outcomes, and as healthcare leaders, we strive to keep tabs on these key performance indicators with the constant goal of continuous and consistent improvement. It truly takes a team, and the perioperative nurse is such an integral part of this team. So let's make sure that they're receiving the most up-to-date, evidence-based information so they can perform the nursing interventions at the bedside that gives that patient the absolute best chance for a successful procedure with positive outcomes. So many ask, who is Periop 101 designed for? And it's really a multifaceted answer. So of course, we automatically think of that new graduate nurse entering the perioperative specialty. So these nurses, as we know, they are sponges looking to soak up the most knowledge they can about this amazing specialty. It's also very important they're receiving the correct information. It's also designed for the experienced registered nurse entering the perioperative specialty. So these nurses have a solid clinical track record to build on, but they still need this perioperative specific education in order to practice safely and effectively in the OR. Also, OR nurses returning to work after an extended absence. Maybe they left to take care of a family member or another reason, and they've been out of practice for a year or more. And as we all know, a lot can change in a year. It's a great idea to get them back up to speed with the Periop 101 program. Also, experienced nurses without formal didactic training who are seeking to improve their perioperative skills. So what I have found is that this population of perioperative nurses can actually be the most dangerous. These nurses can be extremely confident, but their clinical competence and guideline knowledge is sometimes lacking. So to be very clear, we appreciate and value this group of nurses so much. We also need to take a step back and see if we as nursing leaders have given them all of the tools and resources needed to provide the highest quality of care, and that's Periop 101. Also, OR clinical educators, these nurses are teaching our novice nurses, so it only makes sense that they arm themselves with the same up-to-date education that these novice nurses are learning. And preceptors, I used to say that my education program was only as strong as my weakest preceptor, so they need this education as well. And speaking of preceptors, I have found that incorporating this training into various facilities greatly decreases preceptor burnout. If you give the novice nurse the foundational knowledge that's included in Periop 101 before they enter the OR, the preceptor is able to build on that knowledge and really foster a successful, effective, and efficient clinical preceptorship. And it's amazing how much more knowledge the preceptor can share when they don't have to start at the ground level. So with that being said, AORN is proud to have our Periop 101 course in approximately 1,200 facilities, including more than 100 international locations. And we're very excited to work alongside Caroline and her team on this amazing endeavor. Any questions?
Thank you, Jamie, for this introduction.
Yes.
We will answer the questions later, okay?
Mhm.
Our next speaker is Dr. Sumaya Muhammad Al-Balushi. Dr. Sumaya is the President of Emirates Nursing Association, ENA, and Director of Nursing Department at Emirates Health Services, UAE. Dr. Sumaya leads the National Nursing and Midwifery Strategy and the Task Force Committee in UAE. She received the Award of Emirates Pride Medal for Mohammed bin Rashid government and the award for the Best Government Communication Campaign in promoting nursing profession and the Pioneer Nurse Award, as well as the Community Serving Medal in 2020. Due to unforeseen circumstances, Dr. Sumaya apologized for not being with us today. However, we will have her recorded audio message that addresses the national strategies adopted in UAE to advance the level of nursing practice. Let's listen to Dr. Sumaya.
Dear all, it is my great pleasure to be with you today in this webinar for the Train to Return Pre-Operative Nurses and Upscale to Sustain Safe Surgical Practices. One of our major strategic directions in the UAE National Strategy for Nursing and Midwifery is to empower nurses and midwives to be highly competent and skilled in their area of practice and drive more specialization in their field. This is aligned with the ICM recommendations and the global nursing community focus around nursing practice and specialization, especially post-COVID pandemic. Delivering specialization training and certification is one way to achieve that. Additionally, patient safety is always being considered as the core of healthcare services and a key focus for nurses in all areas, especially throughout the surgical pathway. It is one of major excellence standards and an indicator of nursing quality of care that we must endorse and monitor. As nursing leaders, we have the mandate emphasized by international, regional, and national calls to advance the level of nursing practice and establish a specialization that serves the bigger picture of world-class healthcare system. More emphasis is for UAE leaders to meet this call to support accelerating the efforts toward achieving the UAE 2071 vision of healthier and happier UAE community. Again, Thanks for your invitation, and I would like to extend my appreciation for the great team up front and in the back end working towards successful implementation of Association of Preoperative Registered Nurses Education Programs. We hold high expectations for the program and its graduates. Also, I would like to appreciate the experts and audience being part of this webinar. Thank you.
We would like to thank Dr. Sumaya for her sincere efforts in empowering nurses and midwives to be highly competent. She believes that specialized training and certification is a mean in this quest. Thank you, Dr. Sumaya. I would like to welcome our next speaker, Dr. Abdel Ghaffar Muhammad Al-Hawi. Dr. Abdel Ghaffar is the head of Center for Advanced Simulation in Healthcare, CASH, at Gulf Medical University, Ajman. We are privileged to have Dr. Abdel Ghaffar with us today. His support and our partnership with Gulf Medical University enabled us to launch the Periop 101 course in UAE. Dr. Abdel Ghaffar, we would like to ask you and to know your opinion for integrating such program like Periop 101 in universities and schools of nursing to build competencies for nurses and elevate the standard of care in UAE. Can we turn to Dr. Abdel Ghaffar?
You need to unmute Dr. Abdel Ghaffar.
Okay. Thank you, Daniel. I am very glad to join this webinar and see these all experts talking about nursing specializations and training. And first of all, I want to thank Compass Health Consultancy and especially Mrs. Caroline to make our partner with them. We are very happy in the Gulf Medical University that we have partnered with this great company who's working since long time in health services, giving courses to nurses and other people working in the health field of the health. We in Gulf Medical University are very eager to do specialized courses for the nurses. As you know, nowadays, the College of Nursing in our university and many changing happening in the curriculums, many rapidly developing into more technically oriented courses geared toward evidence-based practice more and more. And that the curriculum always is heavy, that the nurses don't have time to do such specialized courses in between or after their graduation. So these courses will be very important to us and to our nurses in UAE. Always we are thinking that general nurses now is something, but we need specialized nurses. And in operation theater, it's very important to have these nurses with these courses and with this important courses, which is applied now to nurses in the Emirates. We're happy to be part of that teaching and that courses, and we look like to have more. In our university, as I am head of the simulation center, we are happy to give these courses based on the simulation educations. As you know, after COVID, the hospitals and the patients became less and less coming to for training for our doctors or our nurses, and the hospitals are nowadays taking so many measures about safety of patients. So the solution was in simulations. Using simulation in these courses give the nurses more opportunity to do and act on the mannequins without any fear, without any risk, to save with the patients. This gives them more trust in their work, take their instructors how to teach more and more on the simulation-based training with a good programs tailored by Compass and tailored by AORA. This will give the nurse and provide them knowledge and provide them practice and give us the patient safety that they are doing these things on a simulation base. That was my opinion. And we like to do these courses and to join these courses in our curriculum, also in College of Nurses and our university. And we hope that with the Compass and with our agreement with Compass Health Consultancy, we'll get more and more specialized courses, especially for the nurses. Thank you very much.
Thank you, Dr. Abdel Ghaffar. That was very insightful. Now we will turn to Basil.
Thank you, everybody, for your input. That is a great, those are great points that were raised. And now we move forward to introduce Professor Michel Jabour. He's a urology consultant from the Emirates Hospital, UAE. We'd like to have your input, Dr. Jabour, about the challenges that you as surgeons are facing in the OR in the relation to the nursing staff and the impact of having competent perioperative nurses in the theater and how they're impacting the safety, the outcomes, and generally the OR efficiency. Are you ready, Professor?
Yes, yes. Well, good evening, and thank you for this effort to join us all to speak about this very interesting topic. Actually, can you hear me?
Yes, clearly.
Yes. So, management of operating room usually requires a coordination of human and material resources to serve one purpose. After all, one purpose is that surgery being performed efficiently, cost effectively, and safely for the best interest of the patient. So that's why a very coherent coordination between the surgeons and perioperative nurses is essential to that task. And here we are facing several obstacles that can hinder the coordination. One of these obstacles is the different backgrounds where the surgeons and nurses are coming from, and we really face that mostly in Dubai. We may not see that difference strikingly, whether in the US where I was trained, or in France, or in Lebanon where I practiced for 22 years. We used to all come from the same background, so it was easy to coordinate. However, here we have different backgrounds, so we have to put more effort and probably write more policies and procedures to make everybody abide by these rules. So at the end, we will have some kind of harmony between all the stakeholders. Definitely, the surgical nurses are a critical part of the healthcare team, and they ensure that patients are well taken care of before, during, or after the surgery. And the problem here, from a surgeon point of view, is that we only intervene when the patient is ready. So we are not really aware what happened to the patient before being ready for us on the table. And we tend to neglect the effort placed by the perioperative nurses in preparing the patient and preparing the room, preparing the instruments, making sure everything is ready for the surgery to be done. And here, the problem can really be solved or tackled if we have a better communication. So communication between the different stakeholders, surgeons and nurses, is a key, all right? The problem from a surgeon's point of view is we really don't know what the nurses are doing. The nurses may know what we are doing, and they surely know what we are doing because they are witnessing what we are doing. But we don't know what they have done. There was a huge effort before we take the scalpel or introduce the endoscope, okay? Because in the communication pitfalls, we sometimes do not know who is the nurse with us, okay? Although sometimes they are listed on the OR list, but we are surprised the day of the surgery to see that the nurses listed have been changed. So we don't know who are the nurses, Okay, we are kept out of the pre-surgical loop completely. All right, and that's why I believe whenever there is uncertainty, it's very important to abide by the basic law of quality and management, which is say what you write and write what you say. We need everything to be written so it can be traceable, and traceability is the other pitfall. To talk about traceability, I'm going to give you two concrete examples. All right. The first concrete example, a surgery was done and there was a routine pathology sent. Luckily, it was a routine pathology and there was no cancer. So the routine pathology was sent for pathology. However, it never reached. And we tried to see who is responsible for that. And we were never able to trace the responsible person. Okay, so this is a major error. Should it happened in a cancer cases, would have been a big medical legal issue. Another issue about traceability is another case where the patient was put to sleep and the instruments were prepared. However, the instruments, once they are open and given to the surgeons, none of the instruments was working. Okay, and we had an issue here, and I'm talking about concrete cases, they are not made up cases. We had an issue to see it was whose responsibility. Is it the scrub nurse? Is it the circulating nurse? Was it the CSSD? Is it the OR supervisor? Why these instruments were brought to the operating room without being checked? And we had an issue about that. So again, traceability is a key factor to quality and success, because this is how we learn from our mistakes. If we have mistakes and we are not able to trace the error to the person in charge, we can never correct that. And the last thing I want to talk about is the specialization. I know this word may not be a nice word to hear from the administrators. Administrators do not like to hear the word specialty for nurses. Why everybody has to be specialized in his field except the nurse? How come a nurse in the operating room need to know everything? She will end up knowing nothing. Okay, while if we have one specialty nurse per department, only one, okay, that nurse will play a major role than being really polyvalent. We can never be polyvalent. We have to assign one nurse to be a specialized nurse for that precise specialty. In this way, we will have a better communication, because that nurse, I'm a urologist. If I have a nurse who knows really the endourology and the instruments, I can have a better communication with her. Whatever I say, she can understand. I can hold her responsible for anything that may happen, and she will feel responsible, especially for the well-being of the instruments. We have a higher cost effectiveness. We have definitely shorter OR time and better handling of fragile instruments. So if we hire one more nurse as OR administrator, we will save 10 times more of the cost of instruments that can be broken when handled by any nurse who is not specialized in that field. So I hope I was able to cover some of the ideas on my mind concerning the relationship between the surgeons and the perioperative nurses and their importance in our work.
Thank you, Professor. You pinpointed very important elements related to the perioperative practice, and we thank you for that. Those are great discussion points, in fact. I'd like just to remind our participants, many of you are placing your questions or posing your questions on the chat box. By this way, we cannot, or we would not be able to answer them, because they will be lost throughout the chat. Please, everybody who placed, or each one who placed a question there, take it, copy it, and place it in the Q&A section for it to appear to us in order to answer it one by one. Okay, this is a side note for you. Thanks again, Professor Michel Jabbour. And now comes the part for our esteemed guest, Dr. Zena Khouri Stevens. She's the Group Chief Nursing Officer at the Emirates Hospital, UAE. And she will be addressing the challenges facing the nursing professions in the private sector, lack of standardization, and the importance of the perioperative nursing competencies. Dr. Zena, you're welcome.
Thank you. Thank you so much. Thanks for this effort. This is great to talk to colleagues from all around and to learn more about the challenges. I'm sure they're no secret to anybody. Those challenges we face, and they sort of are cyclical, right? And they match the cycle of nursing shortage, whether here in the UAE or all around the world. So it's no secret to anybody that we are facing an unprecedented nursing shortage. It's probably because it was accentuated, most likely because of the pandemic that we just went through. A lot of nurses have exited the profession altogether and don't want to be nurses after 2 years of sheer exhaustion. So we're all facing it, whether here locally or around the world. So these nurses need a purpose, need an initiative, need to rejuvenate, especially the OR nurses. The OR nurses face a unique challenge because of where they work, right? You're always isolated as an OR nurse. You're special and you're isolated, and you live in an environment that is high stress, high exposure to infection control, whether infection control issues, high risk, and it's a very high stress position, whether you're working with surgeons, anesthesiologists, nonstop, patients, and you don't get the satisfaction an ICU nurse gets day in and day out. When you're an ICU nurse or a med-surg nurse, you see the progress in your patients. You see the short-lived episode of the OR that the OR nurse goes through may not give her the same satisfaction that other nurses have. So it's very difficult to retain OR nurses, quality OR nurses. And like we all said throughout these few minutes, is that the OR is at the core of every hospital, right? So the OR can make or break a hospital, whether quality-wise, whether financially. Your reputation of a good hospital comes from being a good OR, and from having a good OR. When we look to do any surgery, whether it's elective or emergency surgery, the first thing you ask to yourself is, where do I go? What surgeon, what hospital do I go to? And when you ask what hospital is best, probably you're asking what nursing team is best going to serve me. The surgeon, we all know their skills. We can all look up their skills. Their logs are available. But what makes a surgeon even a better surgeon is having a good OR team around them. So that's basically what we ask for every time we're making sure that our OR function, there's quality, there's safety, and there's a huge financial risk that we take when we build an OR, right? So the efficiencies you can accomplish by being a good OR, by your relationship with CSSD, making sure your instruments are up to date, you keep turning over your ORs efficiently, is key for any hospital administrator. So the OR really brings in clinical expertise and administrative expertise, and they'll only work well together when they go well together. So what the nurses are facing now is huge burnout, right? Everybody's tired at base. We came into this year being tired from 2 years of pandemic. And to top it all up, we all have lost something along the way, right? Financially, most hospitals, at least everybody I've talked to, had suffered a financial risk because of COVID. So now you're stressed even more to up your ORs, to increase your productivity, to increase all of that. So you've added another layer of stress on those nurses. So the key is to keep them engaged, to keep them happy, to keep them trained. And it's more than money. Right? We threw money at everybody. We throw money at a problem every now and again, and we recruit and all of that, but it's a lot more than that. It's really training them and keeping them engaged by training high qualified nurses. There's nothing worse than a nurse in the OR that doesn't know what to do. It doesn't feel right for her, for him or her, as well as the patient outcome is not ideal. So it's very important to keep those nurses trained, whether you do your training locally and in-house, or whether you reach out to companies that can help you, that can help come in and train. The course you just talked about is a gold mine, is something that we all want to take advantage of. Because when you graduate from nursing schools, rarely have you had any experience in the OR, right? So you come into an environment that's very high stress. The expectations are very high. And yet there's no main training. There's no really big training. If we spent some time in the OR, we spent, what, 3-4 weeks during your training, but it doesn't compare to other trainings. So it's very important that we create and tailor a training program for OR nurses, that they can go into a residency for OR, or they can go into an internship for the OR that is 6 months to a year, however long it can be, so they can become qualified OR nurses. And then you can retain them. These nurses, out of loyalty to you, because you've given them something, you've trained them, that loyalty will be fostered by training, and only by training. It's not by money, it's not by titles, it's really making sure that these nurses feel that they can give quality care at any point in time. So this is, this is in a nutshell what most of us go through. I don't think I said something that surprised anybody, except for one little thing I wanted to add, and that Dr. Jabou just mentioned, is the diversity factor. We pride ourselves on being a diverse workforce, and this is a great thing that the UAE enjoys. But that same thing is leading us to very difficult to keep and retain nurses. Those nurses that none of us have this as home to them, right? So your loyalty to your employer and your loyalty to your profession is not the same when you're not at home. When you have a majority of in the private sector at least, the majority of your nurses are expats. So they will go wherever the deal is better. It's not necessarily because I've changed you, because then the private sector suffers from that, and they compete with the government sector that have better benefits and better training program. So we in the private sector struggle a little bit and need to partner with training programs, and need training programs that can keep people engaged and keep nurses engaged in the private sector. So diversity is as wonderful as it is to work with people from all walks of life, as difficult it is to make nurses happy and keep them engaged and retained, as well as standardization. So a little bit of everything is nice, but you lose that standard, and especially in the OR. So you have US standards and European standards and other standards that can come clashing. So what a norm is to me may not be to someone else. And I didn't learn this until I came here. I've always thought, oh, the US way is the only way. Isn't that true? Well, it wasn't, it's not true. And I've been in the region for 8 years, and I realized, well, there's a huge difference, especially in midwifery, for example, and other stuff that maybe not so much inside the OR, but there is different standards. And unfortunately, in an effort to keep people happy and to keep people engaged, we entertain all these standards. But what happens is we don't have a unification of standards when it comes to patient care. And that's what our pitfall, especially in the private sector. The government sector may have those rules and regulations and have standards and licensing behind them that makes it a little more standardized than us in the private sector. When we are trying to entertain everyone's backgrounds and be respectful of everyone's backgrounds, we may dilute the standard as we go along. So it's something we work on, and with training, I think it will be much better, both for standardization and engagement. I hope I didn't take a lot of your time. So.
It was a great contribution from your side, Dr. Zaina, highlighting experiences and feedback from a private sector point of view. That's really great. We thank you for that.
Thank you.
Thank all our esteemed guests in this webinar. We'll be moving now to take some questions. And before that, we may have a testimonial. Is that ready, guys? Jamie?
Yes, I do have it ready. How about I'll do that, and then yeah, if people have questions, they can pop in. So it'll be about 4.5 minutes.
Okay. So would you kindly share that?
Hi, I'm Marianne Toledano. I work for Ochsner Health. I'm the perioperative services educator for the system, and I am the one who assigns the ARN modules. I work closely with all of the students. I teach them and coordinate all of their education and their, it was just a ordinary regular program. The modules weren't that fancy. They were just the content. You had to read everything. ARN went in and upgraded the entire system. It is very interactive. You click on different things pop up, and the students that took it, ones that are taking it now, they tell me it's like totally different. It's the my older students will go in and see the new system and they love it. They're like, oh, well, I like the new system though. I want to do the new system. But even even some of the older nurses that have never taken a peri-op class, they just learned on the job because that's how it was back then before ARN developed this awesome program. They look at it and they want to take it too, even though they have 20 years experience. They want to take the peri-op course because it's so awesome. It's so helpful. It's interactive.
So it gets buffering.
It's going to keep them engaged. And that's the part that is difficult with some of these younger generations. They do need to have engagement strategies just to keep them interested in what they're seeing. And ARN did an amazing job updating those modules and just redoing the whole course. The students absolutely love it. And they updated the content too, not just the interactive part, but the content is much improved. I've added a lot of things that are new that have been developed. So they upgraded as far as like technology advances and things like that. The students that I have in my class, it started after they upgraded the system. They would come to class and say, I taught my preceptor something. And the first time I heard that, I was like, wow, really? But now I'm hearing that a lot, that the program is so thorough and has so much information. And because it's keeping them engaged, they're retaining this information and they are sharing it with their preceptors, and they're teaching their preceptors, which is really, really interesting. It's really funny. So I had a conversation with some of them one time and I said, so what do you think about that? Teaching your precept or something? Does that worry you, or how do you feel about that? Oh, we love it. We love teaching our preceptors things. So it's really been interesting. But the program, I gotta say, they love the ARN Periop 101 program. I can't say enough about it. They love doing the modules. They'll do them multiple times. It really does prepare them for the final exam also. And that's the biggest part, is because that's a mandatory.
Well, there were some issues there at the end. I apologize with the buffering, but I hope you got a good sense of, she goes on to say that the nurses are coming out very competent and confident. And she said, there's really nothing else out there like AORN's Periop 101 course. And she said, I don't know what our system, it's a very large system in the southern part of the US. She said, I don't know what we would do without this. It's really been just a game changer. So hopefully we got enough in the beginning of the video to get a gist of that. So thank you.
Yes, Mr. Jamie, thank you for highlighting this throughout the testimonial from one of the preceptors. And we appreciate that, taking the effort of preparing this participation. Now we have a bunch of questions that are posted in our Q&A. I have a question. I'd like to start first with Miss Linda. You're still with us, Miss Linda?
Yes, I'm
Linda?
here.
Oh,
I'm-
great. So basically, just as an overview about such implementation of such course in a healthcare setting, in a hospital, in an institution. So how can you define its direct or the importance of this to them briefly, and what they will gain and what will be their return in investing in such a program? If you can just highlight a few points in that for those people, our colleagues, administrators, who would be concerned about this one.
Thanks for the question. I think it's a really important area that needs to be considered. We know that we've talked about COVID. COVID was quite a crisis in the nurses that went through COVID were exhausted. Many of them have retired or have cut back on their hours. So we know that recruiting nurses is a #1 priority in many institutions. And recruiting nurses is the first piece. But the important part of that is that once you recruit them, you have to give them some adequate training and so that they really feel efficient and proficient at their job. The operating room is definitely a team sport. And it is very important that the team work together. And through the course, through Periop 101 and the modules that are completed, the emphasis is on the team and accomplishing the best opportunities to provide safe patient care for the surgical patient. The operating room nurse is responsible for the preoperative areas, getting to know the patient, doing an assessment so that that information can be used during surgery, whether it's positioning the patient, whether it is allowing the opportunity for the relatives to know what's going on during surgery. Some of the circulators will maintain that contact, but it really is an opportunity for nurses to practice the full extent of their license. They are in the pre-op, the intra-op, and then post-operatively to give some instructions if the patients are going home, if it's an outpatient procedure, or talking to the nurses on the unit to let them know what happened during surgery. The operating room is a very closed area, and only the people that go there every day can really appreciate all of the crises and the way that the patients are cared for at every single case, and how important that care is to the patient. There's one patient in that operating room at a time, and that's where the focus of the team is. And that's what Periop 101 focuses on. And it does focus from the pre-op through the post-op areas.
Thank you, Linda. That was outstanding. Thank you so much. We have a couple of questions in the chat box related to where this course, what is the way for those people who are asking to participate in such important course. Caroline, can you just highlight for us, please, some details related to the course, how it is performed, and how people can reach out?
Okay, thank you, Bassel. First of all, thank you all for a great insight. And really, we are, I think—
Caroline, we can't hear you.
I'm unmute. Hello?
Yes, yes. Okay, go on, please.
Okay. I was saying thank you so much for your insight. Really, it's very informative. And we know that OR for people working in a hospital is like a taboo. They don't want to go there because they don't know anything about it. So it's better not to know what's happening in the OR. And this including competency. And again, when you have a knowledge, you have better performance, your patient safety is achieved. I would say the program we started in UAE, but we're taking the program outside UAE. We will be in Saudi, in Oman, in Kuwait, and in Qatar soon as well. How we are enrolling the people, definitely we are working closely with the Ministry of Health, with government, and with private hospitals to select the people, the right people for the program. And this is important. We are assessing the people. The program has 23 modules, so we want to know the people knowledge, skills with these 23 modules before they start. And then when we start executing the programs, we are working together with them. And at the end, before the test, and after this test will be assessed, and we see where we are and how the program really worked to improve their knowledge skills. You know, we're delivering the program in universities as well in hospitals. Some hospitals are approaching us to do the program in their facilities as well. Some of them, they have training centers. So we are open. We are partnering with universities. The program we started with the Gulf Medical University. It's a great simulation center there. We have a big operating room. All the equipments are there. And we are training the team on dummy for the time being, give them all the skills, giving them all the requirement, and then they are taking their knowledge to the hospitals, working with their preceptors in the hospital to make sure they are executing what they are knowing. And I agree that the preceptors should have a knowledge as well with the up-to-date standards. That's why I was telling the team that we had the course with them. Now you know, so your responsibility to check your policy, your procedure, see what is the best practice, and check if your policy has the best practice or not. You need to speak up. And what I like about this program is not only we're focusing on the knowledge, we're focusing on the critical thinking, on the people how should react, because this is very important, the critical thinking, and how to deal with situation, because knowledge is not enough unless you transform this knowledge to the real case scenarios. So this is where we're empowering the peri-op people by living the brand, who they are and how much they are important when it comes to surgical care. It's a team effort. But guess what? Like Professor Michel was saying, yeah, they are the unknown soldier, right? We don't always appreciate what they do, but they should know that they are a very important element when it comes to OR, because for patients, they are the angels, that they are there to be there for them where their family is far away from them. And I think this is where in the Compass, where we are working with the participant and ensuring that the knowledge is transferred and the passion to OR is transferred too, because not anybody can be in OR. You can be everywhere, but OR needs special skills.
Thank you, Caroline. That's insightful. Let me check if we still have other questions. Natalie is asking about the simulation and its importance in training courses, and about, we'd like to have some insight. We still have Dr. Abdul Ghaffar with us here.
No, but I can answer the question about the simulation. Yeah.
Please, Caroline. So about the simulation, how it is integrated, and if you can elaborate a little bit about how it will be used.
You know, the perioperative program contains 23 modules, and each topic is different than the others and requires special skills. For example, we're going through the medication and anesthesia management modules. These two courses will be delivered by anesthesiologists. So the anesthesia doctor will demonstrating all the process that they deal on patients on a dummy to the students. So we are making sure that all the instructors are meeting the modules that should build the competency of the team. Like we have surgeons, we have anesthesiologists, we have OR manager, we have CSD managers. The course is perfect with the knowledge, but guess what? We're bringing the expert people to transfer the knowledge and talk about their experience. Because at the end, it's a human experience as well that matters, right? Because the knowledge is good, but the experience and the journey that the person has in that expertise as well will influence and will impact the other person. So the Gulf Medical University and the others universities we are working with, their simulation centers are really well equipped and has everything that we need to show the participant from pre, intra, post preparations, and they have everything. And the hospital after that are monitoring and working with them to ensure the knowledge is transferred, and definitely they can start trusting them, give them access to the patients under the supervision of their preceptors too.
Thank you, Caroline. A question also as a detail related to the program. Is it given on a personal level or only available for groups or facilities?
Basically, we are working with facilities as well as with personal levels. We are connecting people from different hospitals as well to deliver the program. Can be as well managed.
Okay, great. So if anybody would like to reach out to know more about this program and its implementation and how you can bring it to your institution, please, I put in the chat box the contact details for the Compass, the phone number of Caroline and the email. Please reach out and talk to us about anything you want. Before ending, because we're reaching the end of this webinar time, before closing, I would like to ask if anybody of our esteemed guests would like to add any comment or to have any input, especially from Linda, Jamie, Dr. Zena, Professor Michelle.
Okay,
If no
so
further,
I'll be glad to make some comments and just say that, again, we are just delighted to partner with Compass on this very involved, but very informative and very important program. I think it's a great opportunity for the nurses and spreading the word and really having the nurses feel competent and confident goes so long and so far for retention and recruitment. Nurses that know they're going to have the opportunity to participate in this program will choose the sites that they want to apply to based on the fact that they will have an opportunity for this advanced education. And it does go a long way for them to establish their confidence and to provide safe patient care to every patient every time. Thank you for the opportunity to participate in this panel.
thank you, Linda. And thank you, everybody, our esteemed guests, our participants, for your valuable time participating with us. We favor your contributions, and everything that you said was very insightful. The Compass, as an exclusive provider for the Perioperative Course 101 in the Middle East and Africa regions, will be working with the partners to integrate this program to nursing schools and hospitals that are both governmental or private to build nursing competencies and elevate the perioperative nursing standard of care. We reach now the end of this webinar. Thank you so much. We stay tuned for future announcements for additional webinars that are educational and for any announcements from the Compass about the future courses related to Periop 101. Thank you so much, everybody.
Thank you so much, everyone. Have a great day. Thank you.
Bye-bye.
Thank you.
Bye-bye.
Thank you. Bye.
Bye.